Today's Insta Live session is going to be a Q&A session on difficulties in cancer management. And today we will be having Dr. Shrikant sir with us. Sir has come online, so will be joining us in a minute. And before that, I will just like to introduce Sir. And Sir is a practicing homeopath at Prana, which is located in Pune. And there he is in charge of the cancer care clinic. So welcome, sir, to today's session. And today we have actually a few questions that we have to ask you. So can we start today's session?
Yes, Karishma, welcome back. Last week we did one. This week we are doing another. Yeah. So
Yes,
please,
sir.
let's start.
Yes, sir. The first question is, when a cancer case comes to a homeopath, how can he assess, like, what would be the scope of homeopathy in this case?
So for that, firstly, we should have clinical knowledge. So we should know what is the type of cancer we are dealing with. So whether it is an aggressive cancer, whether it is a slowly progressive cancer. So for example, lung cancers and brain tumors, pancreatic cancers, these are very aggressive kinds of cancers. In such cases, there will be less chances of cure of patient, etc. You should start thinking of palliation, etc. But however, there are some slow growing tumors. For example, neuroendocrine tumors, prostate cancers, basal cell carcinomas, very slow progressing tumors. And there you can think of complete reversal, even with homeopathy. There you can think of very long-term life for the patient for 15 years, 20 years, provided the patient does not have any comorbidity. If the patient does not have any other illness like diabetes, blood pressure, cholesterol, overall health of the patient is very good, then in a slow progressing cancer, the life expectancy and the results from our treatment are very high. But if there are comorbidities, then even in slow progressing cancers, we will expect less results. And if aggressive ones have even comorbidity, then the result is even more lower. So these are the rough guidelines. First, look at what is the aggressiveness of the cancer and what is the comorbidities. Based on that, you should be able to decide what is your scope.
Okay, sir, got it. So, related to this, the next question would be how to deal cases which come at advanced or terminal stages.
So, advanced and terminal cases are the best cases to get as a homeopath. Because first, patient has taken all treatments have failed, patient has come to you. So patient knows that they are going to die. So there's very little risk. There is very little damage that you can do. All damage is already done. Only thing you can do is give the patient relief, or patient is going to go as it is. So that's why I say they are the best cases. And they are the most common cancer cases that we get. People come to us after all treatments have been taken. So that's why I think people should take up cancer cases, especially terminal ones, and do all these the best that you can, and from that you will learn how to treat. And
Okay, sir.
one is remedies, but secondly, I think knowing how to manage a case is also important. See, finding a good remedy will relieve the patient, but there are other aspects in cancer management, like good diet, how to give diet to the patient, because patient is too weak, they don't or they are not able to eat. You have to give liquid. Still, you want to maintain hygiene, good nutrition value. How to do all of this? When to give some sort of fluid replacement or saline or etc. because patient is got it got dehydrated. All these aspects are also important when you are treating terminally ill patients.
Got it, sir.
Yeah.
Okay. So, like you said, when patient comes to us after taking all the conventional treatments, so does homeopathy has a role in treating side effects of chemotherapy and radiation? Can you share some insights related to this?
Yeah. Firstly, patients who are terminally ill are those who will give up on all this chemo radiation. So generally, patients who will come to us for side effects are those where there is good amount of hope of recovery. No, majority of them, there are few, even if there is no hope, they want to take chemo, but majority are those where there is scope for recovery, where there is, uh, you know, uh, chance for the chemotherapy to work and really reduce the cancer size, tumor size, and help the patient recover, or in leukemias improve the blood count, etc. So those patients come to us, and chemo is given to those patients who have good amount of, you know, vitality, good energy, they can tolerate. Not everyone is given chemotherapy, not everyone is given radiation. You have to have certain amount of good health for you to be able to tolerate the chemotherapy, its side effects, all of that. So considering this, it is important that we start giving remedies based on the patient's vitality and individuality, because the vitality is high, no, you will get characteristic symptoms. And most often what I have observed is the same remedy that seems to be indicated for the cancer or for the patient as a whole is the remedy that helps to recover from the chemotherapy side effects also. In fact, I have many patients who I'm just giving the same indicated sort of remedy, and that remedy is giving minimal side effects even though the patient is taking chemotherapy or is undergoing radiation. And I have not found the other remedies, for example, just giving the same remedy in potentized form, like suppose the patient is taking carboplatin, give carboplatin in potentized form, or cisplatin, or cobaltum, or radium brome, or remedies like this. Very minimal relief is seen in patients. Yeah, 10%, 20%. But if you do the same thing with the indicated remedy, the results are unbelievable. They are 70%, 80%, 90%. So the question is, what is the percentage of relief that you want to give your patients? And once you see that you can give 70, 80%, then definitely you're not happy with 20, 30%. That's why I don't use all these sort of tautopathic prescriptions. I rather use the same indicated remedy approach, and that gives
Okay, sir. Got
much
it.
better results.
Okay, okay, sir. So, the next question would be, can you share one case example where homeopathy has helped the quality of life in a cancer patient?
it, uh, I think I see that daily, every day. So just to give one very big um, sort of change that I saw, and if some of you have attended my webinars or seminars previously, you might have seen this case of an old woman who had developed left lung cancer with complete left lung being collapsed, and she was given around 6 months of life expectancy, and based on ailments after grief of losing her daughter-in-law and patient having homesickness, etc., I gave her the remedy phosphoric acid. Patient lived for 4 years after that we started her on phosphoric acid. She never took any chemotherapy, radiation, anything. She was too weak to be given any such therapies. So after 1.5 years, what happened is, in her family there were radiologists and there were MD physicians. They saw that it's 1.5 years, the patient is still alive. So they thought they misdiagnosed the case. So they said, we will reinvestigate. They reinvestigated. And then they saw, yes, the patient has cancer. This is a classical case of left lung cancer. So they said, how is she living? And as I told you, no, in the beginning today, lung cancer is one of the most aggressive cancers. So it's more than 6 months life expectancy with no chemo, no radiation. They were very surprised. Now what happened, what surprised them even more is, she was even climbing up 1 or 2 floors. They said, how can she climb up? She does not have, one lung is completely like non-existent. And not only is it non-existent, the other lung is compensating so much that she's able to climb upstairs. How can this happen? This just completely beats logic. And in their own word, they said that this is miraculous results. We can't believe the results that we are seeing with homeopathy. And this is what allopathists are saying. So that's what you can achieve if we do the right kind of homeopathy and find the right remedies, indicated remedies for cancer.
Yes, sir. So even I am getting motivated to take on cancer cases after listening to you. So for all our viewers today, I have the last question, which is how can homeopaths equip themselves to handle such complex cases effectively?
Attend my webinar.
Yes, sir. Please tell about that.
So, firstly, see, all said and done, what you have to do is you have to learn the art of how to find characteristic symptoms. See, the most common question that comes up is, in cancer, how to find characteristic symptoms. That is what we will learn. Okay. And in such disease, or in treating any pathology, you have to have good clinical understanding. Clinical understanding most important. If you don't develop clinical understanding, you will not be able to treat any pathology, not only cancer. So that's the first thing that you have to learn. Then from that clinical understanding, you will know where to look for characteristic symptoms and how to look for them. Then you combine this knowledge of characteristic symptoms, and then you look at the mental symptoms of the patient, the physical generals, desires, aversions, etc. And then you find the remedy that fits all three levels: the characteristics, the mind, and the physical generals. That remedy seems to work the best. And then you may need to, in the course of treatment, like we discussed today, give some complementary therapies like diet, like yoga, that like acupuncture. All this also I use. So I'm going to share some cases on how the role of acupuncture or diet or yoga has helped me in my practice, how I'm integrating the other complementary sciences for the benefit of the patient, for relief and longevity. And these are again cases which are treated exclusively by homeopathy. As I have been repeatedly saying, no, majority of my practice is patients treated exclusively with homeopathy in cancer. So those are the cases that I'm going to share, and long-term follow-ups. So I'm really excited to share this, and I really hope all of you join and we learn from this experience.
Sure, sir. Sir, actually, we have one question from our viewers. It's by Dr. Akshay Patwa. Question is, can we stop allopathic medicines when we treat cancer patients with homeopathy?
So, as I told you, no, majority come after doing everything. And if you get a patient who has been taking chemotherapy and you want to stop the chemotherapy and only give homeopathy, all this has to be again done based on the patient. Subject, it's all subject to patient. Actually, there is there is no one answer for all this question. So if the patient is old age, if it is advanced stage, patient is also willing, then you can do that. If it is, suppose it's a oral cancer, then doing surgery best option. There is 80% chance that patients don't have relapse if they do surgery. 90% patients don't have relapse for more than 5 years if they do surgery followed by chemotherapy in oral cancers. Then when the allopathic side is saying that we have 90% results, then I think we should not try to touch those cases. There are enough of other cases where we have scope, where they themselves are saying we have only 10%, 20% scope. In such cases, we should do this. So it depends on patient. It depends on patient's type of cancer, patient's overall health, patient's age, patient's comorbidities. Based on that, we decide. So, like individualization in homeopathy, this is what is individualization. You decide based on the patient.
Yes, sir. So one more question has come up. What would be the ideal potency to begin with in such a case?
Again, everything is individualization. Patient decides. Advanced case, lower potency. Less advanced case, higher potency. Sometimes even in advanced last stage cases, we are giving high potency. So all this is subject to case. There is no one standard answer that I can give. And you will get more clarity when you learn from a case. When I present a case during this webinar, how I choose potency, why I chose this potency, why I gave this repetition. That understanding, once you start seeing, then you will get a rough idea of how you should be choosing potency. So what needs to be learned actually is the process of choosing potency and repetition, rather than trying to think what is the best potency. There is no one best potency. What we need to learn is a method of how to choose potency and repetition.
Yes, sir. So we have come to an end for today. The questions have ended. So I would like to tell all our viewers that this webinar is coming now, and it is going to be on 4th and 5th February. And the details regarding the registration is available on our Insta profile. The link is also there in the bio. And also the details will be there in the caption of this video too. So everyone can refer. And I would like to request all our viewers to join us and learn more about how they can take up these complex cancer cases and give results in their practice too. Thank you so much, sir.
Okay, welcome.
Yes. Bye, sir.
Bye, Karishma. Bye, everyone. Thank you for attending.